Our protection procedures started from the minute the client called in. If they reported any coughing, it was flagged in the file. They were informed not to come into the clinic, to stay in the car, and that we would come to them when we could.
We were in personal protective equipment, so cap, mask, gloves, gown, and booties with every patient. And we followed true PPE protocol within that exam room or in our isolation unit.
If we had pets that were sick for other reasons, they used other rooms. If they were healthy, they used other rooms. But we had our coughing dog rooms.
They had us bring them in through the back so that we didn't go through the front lobby where other dogs were. And immediately, Dr. Marks knew what it was. They took him in, they put an IV in, they got a nebulizer on him, they got him in to stabilize him, which was the first and foremost.
We had one tech basically assigned to those patients so that we weren't cross-patient handling throughout the day. We had very, very stringent guidelines as far as owners visiting. They were gowned if they were coming up, and we certainly encouraged them to limit that time for obvious reasons.
While the biggest outbreak actually happened in Chicago or in the Midwest area in spring of 2015, we were actually seeing little populations of outbreaks for the next 6 months. And it's springing up in different areas. We saw it in Minnesota, and it was literally because a dog was boarding in Chicago several weeks before. And unfortunately, because of travel and airplanes and driving, that's how outbreaks happen.
The task force was formed as a collaborative effort to really share the information that we were collecting about the virus.
Involved the collaboration of a number of diagnostic laboratories and scientific research groups around the country and around the world.
We were able to share data with each other so we could see where the virus was and map locations where we were getting positives. We were able to, talk about what we were seeing in the diagnostic testing and the clinical signs, and to just glean from information that we all sort of brought to the table.
So now that we know H3N2 exists, who knows what else is out there? And so it's been actually very helpful trending our clients and working with the local daycares and boarding facilities, helping them understand the virus and understand the shedding and how to kind of tailor down their protocols and screen their boarders and their grooming patients so that they can limit disease.